Well, good morning, everybody. John McEwen here with the New Jersey Theater Alliance, and so happy to have you today for as we kick off our roundtable series for the fiscal year. And as many of you know, we always start the roundtable series on marketing and websites because that is so essential to all of our work as we build awareness and gain audiences to our programs. So we're really looking forward to today's conversation. As you know, it is a peer-to-peer conversation, so we want to hear from all of you after our presenters share some of their thoughts. And please drop your comments, your questions into the chat. Kat does a great job about checking the chat, so we will pause periodically to look at any of your questions and comments and address those as much in real time as we can. So I'd like to just first give a visual description of myself. I'm a white cis male in my early 60s with brown and silver hair parted on the side, a mustache and goatee. I am wearing glasses with bright blue leg frames and clear eye frames. And today I'm wearing a quarter zipper sweater, blue sweater, and I have a blurred background, and I'm coming to you from Asbury Park, land of the Lenni Lenape. So I'd like to say hello to Lindsay Dandio. Good morning, Lindsay.
Hi, John. Hi, everybody. So I am a program officer and the access coordinator at the New Jersey State Council on the Arts. To give a visual description of myself, I'm a white woman in my late 40s. I have long, pretty straight brown hair. Today I'm wearing a black sweater and it's got a little beige and black polka dot collar, beige and black shirt underneath. I have blue framed glasses. And I'm also coming to you I'm coming to you from our offices in Trenton, which is also the unceded land of the Lenni Lenape. And I'm just so happy to be here today on this kickoff day of Access Thursday. The Arts Council, in partnership with the Cultural Access Network, is really pleased to provide these really important access tools and this peer learning for the cultural community. Um, and I'm really looking forward to today's content and learning more about uh, targeted marketing because there's always so much to learn about marketing and websites. So many new things that come up. So happy to be here with you today.
Thank you, Lindsay. Hello, Kat.
Good morning, everyone. I'm Kat Lilly. I'm the Access Coordinator for the New Jersey Theater Alliance. I am a white female in my early 40s. I have brown shoulder length hair that I'm wearing half up, half down today, and slightly cat-eyed glasses with blue and purple frames. And I'm wearing a gray sweater with three-quarter sleeves. And I'm coming to you from Medford, New Jersey, land of the Lenni Lenape.
Great. So we're again, so delighted to have you all with us this morning. Thank you so much for being here and for your ongoing commitment to cultural accessibility. And we're really looking forward to hearing from Laura today, who will introduce herself, who's going to share with us. We're going to start off by going over some best practices and tips with regards to website accessibility. Just a reminder, please drop in some questions and comments into the chat, and we'll certainly get to those. But I'm so happy to welcome Laura. Good morning, Laura.
Hi everyone. Good morning. My name is Laura Itori, and I'm really happy to be here today. So I want to first of all thank you, the Cultural Access Network Project, and the New Jersey Theatre Alliance, and also the New Jersey State Council of Arts for making this possible. So my passion is focused on making um, digital experiences that are very inclusive, effective, and welcoming, not only because it's the right thing, but because it's core to reaching the audiences we all want to connect with. So for me, this is very personal because I'm blind and I've spent most of my life using websites that are curated for everybody, and some of them are built with people like me in mind. Some websites make me feel supported, and others, well, I feel like I am not able to access even basic information or buy a ticket. So what we want to do today is probably connect those dots, and how does accessibility directly impact your target audience, your marketing success, and your digital strategy. So these things are all connected, and today we can be able to explore how they're all connected and how we can make it a better experience for people living with disabilities. So most organizations think of accessibility as a compliance regulation, but which it is, but in many institutions, it is also marketing, because disabled audiences are part of your target audience. For example, like for 1 in 4 adults in the US has a disability, and many are active participants, like artists, donors, patrons, and even community leaders. And this is a huge audience to reach out to. So a website that works better for people with disabilities works better for everybody, including senior citizens, people with low bandwidth, people who have injuries, and people who are just maybe on the go and can make use of accessibility features. So having inclusive websites and accessible websites, it improves your ticket sales, mail list signups, donations, repeat attendance, and trust and credibility in your organization from people in the disabled community, because most of us tend to want to stick to brands that are loyal to us and offer accessibility services and accessible websites. That is something I do a lot. Like when I'm going to a website and I'm able to navigate easily and I'm able to purchase my tickets without even asking for third-party help, I'm able to stick to that brand more and more, and I'm much more loyal, and I would be able to introduce many more people to that brand. So accessibility, from that example, accessibility increases your reach, your retention, and your reputation among the community at large, including the disabled community and just the general public. So here are some of the barriers that people living with disabilities face, including some from my own lived experience, because as I mentioned earlier, I'm totally blind. Oh, and sorry, I forgot to give a visual description of myself. Just to give a visual description of myself before we go ahead. I am a Black woman with dark skin, and I have black hair in a half up, half down design. I'm wearing a black top with a white tie. Okay, and I'm giving a small wave if you can see it. Anyways, so we can go back to the presentation. So some of the barriers that I face on inaccessible websites is missing or incorrect alternative text. This is text that give like description of the pictures or the shows or events that are being promoted. You can find an image description that says image123.jpg. I'm not going to be able to know what that is when I go to that website. I'll just probably ignore it, and it probably had some valuable information that I could have used when I would be visiting that website. So confusing or inconsistent navigation. When you have menus that change on each page and label buttons, and poor heading structures can trap me when I'm using my screen reader, for example. And then also hidden or hard to find access information. So if I'm on a website, most of the things that I look for is how I can be able to contact the organization or the company, and if they have any accessibility information that would be worthwhile for me to use when I'm on their organization's website. And even it gives me much more trust with the organization, because I will be able to communicate with them effectively, even if I'm going to attend an event or a performance, because I know they have me in mind in terms of my disability, and I'm able to even ask questions. So accessibility services should never be buried, because I feel like whenever I go to a website and there's no accessibility service, I just feel like maybe this page is not for me, or this organization is not for me. So I feel a little bit excluded, and I miss out on some of the events that would benefit me or I would be able to enjoy. So some websites have forms and ticketing barriers. For example, if I'm going to a website and I want to book a performance, I'm not able to do it because these buttons are not labeled. They require drag and drop elements and captures that don't have alternatives. Like, for example, I am totally blind. If they tell me to spell out the numbers in a capture, I'm not going to be able to do that. They could give alternative methods, such as using audio cues and other alternative methods for people facing different disabilities. And then small touch targets for mobile users. Believe it or not, accessibility benefits mobile users a lot. And many people nowadays use mobiles because it's easy and it's reliable. So having small targets is not convenient for mobile users, and this is an accessibility feature that many people usually ignore. And we also have some websites, or many websites, that have videos without captions, which kind of makes the deaf and hard of hearing community to lose the entire message. And at the end of the day, they might not even be interested in such an organization because they did not get the information at all. So there are some foundational elements that every organization should need to support their targeting marketing strategies. So effective use of alternate text. Like I mentioned earlier, alternate text is description for people using screen readers. And the description should convey the purpose and not necessarily like junk information. So because in many why it matters to marketing, because your images are your marketing. When you're able to market your images to, let's say, blind and visually impaired people, you are able to convey the messages sent out through your images and pictures and the call to action that your marketing intends. So some of the best practices would be, like I mentioned, the alternate text should describe the purpose and not just their appearance. And decorative images should have quote unquote empty in the coding, so that the screen readers can just skip them entirely. That way you're not just conveying unnecessary information. Complex graphics should be given like extended descriptions and accessible tables. That way, for example, if I'm using a screen reader, I'm able to go into these complex graphs and I'm able to look at the seating arrangements or charts with using my screen reader, and I'm able to do it without asking for help, because sometimes help is not always there. So clear and intuitive navigation. Good navigation is essential for targeting marketing, because this enables everybody to be able to navigate the website efficiently without having some type of frustration, because this is some of the challenges that I face, and without wasting time. I could be easily trying to go just purchase a ticket for a theater performance, but the time I waste looking for navigating the website or even trying to buy the ticket could lead me to be frustrated and give up entirely on even wanting to go to watch the play. So you should use consistent menu and wording across all pages, because the consistency is better that way. Even for people who have disabilities, you're able to easily expect what is on the next page because you have experienced it on the previous page. And then we should provide clear headings, so like H1, H2, H3, and this is good. This is good just because it's a logical order. And then in some websites, we see a skip to main content button at the top. This button is very helpful because it just takes you directly to what is necessary before you go through all the other things at the top, like the menus, that is just consistent all over the pages. So we should avoid keyboard traps on drop-down menus because it's just, especially when you're using screen readers, it's very hard to get out of these traps. So accessible access information. People should not have to search for accessibility information. It should be built into your marketing flow. So for example, include accessibility or access services in your main menu. Clearly outline available services like audio description, ASL description, captioning, ASL interpretation, sensory-friendly shows, and captioning. Offer multiple contacting options. For example, email, phone, chat, and use clear language. For example, need help with accessibility, or contact us at this for accessibility help, because this sends a clear message that you have accessibility services in mind. And the word accessibility is well known around the community. So there are WCAG 2.2. WCAG is the Web Content Accessibility Guidelines 2.2, and they're the latest ones that should be followed by every website, and every website should be compliant to them because this enable people, they're just rules for accessible design, and they enable websites to be more accessible for disabled users. So here are some of the website WCAG success criteria that some organizations should focus on first. So focus, not obscured. So when you tab through a site, the focus item must be visible, not just it shouldn't be obscure even to people who are not using screen readers. You should be able to see what you're tabbing through. So focus appearance. So links and buttons should have strong outlines. Like we should be able to hear. We should be able to hear like the word. For example, if you're using a screen reader, the word button, link. For those who are not using a screen reader, they should be clearly able to see that this is a button and this is a link. And they should be labeled effectively as well. So the target size, like I mentioned earlier, buttons, for example, should be big enough for people who are with motor disabilities and people who are using mobiles, because it's just easier. It's an accessibility feature that makes things simpler for people with disabilities and people using mobiles. So dragging movements. Any drag actions must have a simple alternative, because, for example, like I mentioned, if I'm using a screen reader, it's virtually impossible for me to do a drag and drop movement, but they should have an alternative on the website for people who are using different accessibility technology. So consistent help. So like I mentioned earlier, access help should be consistent on all pages. For example, if I know the access help is in the drop-down menu at the top, it's easier for me, no matter which page I'm in, I'm able to go into the menu and look for access help or accessibility help. So they should not be redundant entries. Like, for example, forms should not ask for the same information twice, because that just, like I mentioned earlier, it wastes our time. Even if we're using screen readers already or access or any other devices, it already takes time to use these devices. Why add more to that when we can be able to have an easier and efficient way of using this website? So we should have accessible authentication. Like I mentioned earlier with the captures, users should not have to solve puzzles or remember tricky passwords to be able to authenticate anything. We should have alternative methods of authentication. So how does accessibility boost target marketing? It's not just about removing barriers, but it's also about strengthening your marketing outcomes. A huger audience reach. So accessible websites reach to seniors, disabled users, multilingual users, and people with low bands in low band areas, because it's just easier to have an accessible website reach a huger audience. Hence, you increase your audience reach. So you have greater user trust. Like I mentioned earlier, every time I go into a website that I feel is accessible for me to use, I will keep on coming back to that website. And this makes me trust them more because they have accessibility in their mind. And we all tend to be loyal to websites that we have ease of use and find much more efficient and welcoming. So when we see clearer communication, accessible content is better structured and easier to read and more engaging. This is another byproduct of accessibility. It's just easier for everybody to be able to understand things on an accessible website rather than a convoluted website. So removing friction, so we have higher conversion rates. So when you remove friction amongst your users, it increases things like ticket sales and attendance. And also we have community alignment. So accessibility reflects values, equity, and connections. So maybe some practical steps some organization can do to take steps towards accessibility is mostly they need intention. They don't need a huge budget, and they need realistic priorities and being more consistent. So maybe they should include accessibility from the they should make from the beginning stages. So they should make accessibility part of every initiative. It is much easier to include accessibility at the beginning than at the tail end of things, because already it's part of the culture, and it just leads to having things much more easier than coming back to correct past mistakes. Another standard practice is to require alternate text and captions and other accessibility, like accessible forms and other accessibility features as standard practice. So another easier way is to conduct user testing with disabled patrons. Many of us in the disabled community are very open and willing to do testing for many websites because we know we want to be able to access the information and products on these websites. So it is also a good practice to include the disabled community in the testing phases and also in the implementation phases of our products. So we should also ensure that access services are part of every target marketing campaign. Whenever we have events, make sure to include like access services, like I mentioned earlier, captions, audio description, and etc. So there's much more technical things we could do, and I will send out a slide deck with some more information. We can refer to WC3 for much more technical information in terms of accessibility of websites. So in terms of my own experiences, I've mentioned some of the barriers I have faced and some of the things that I feel would be great to include in terms of when we do the websites in the implementation phases and in the beginning stages. So they should also like allocate resources for auditing and remediation. Many websites nowadays are having doing accessibility audits, which helps them improve greatly. And they should all model They should accessibility in all public communications, even when we send out flyers, as a public service announcement, just remember to include accessibility features. So to close, for me, accessibility is not a side project. It's just a way of honoring the communities that we all serve, and it ensures that everybody is feeling fully welcomed and inclusive. And for me, as someone who depends on accessible technology every day, when a website is truly inclusive, I feel like I belong. So if anybody has any questions for me, please feel free to ask.
This is Kat. Thank you so much, Laura. I just want to read out a couple of things from the chat.
Yes.
And then there is also a question. So someone asked if there will be a link to this guide, and there will be slides that we will make available after the roundtable. And then
Yes.
Ronnie and Lindsay both linked the web content accessibility guidelines in the chat as well. And then the question that we had, let me scroll back up. Are there samples of websites that people could look at that are effective for blind and low vision patrons? John did mention that the Garden State Film Festival will be bringing up their website soon, but Laura, I wondered if you had any other suggestions.
In terms of cultural organizations for like performances and arts and stuff, I will say there's what is it called? I don't know. I don't think NJ Pack, or is it the Paper Mill?
Oh,
There is
probably Paper Mill.
Paper Mill. Yes, Paper
Playhouse.
Mill
Yes.
is a good website. And which is the other? Is it TDF, the one that offers subsidized tickets for
Yes.
Broadway
That's
shows?
the Theater Development Fund. They're out of New
Yes,
York City. And
yes,
yes, they offer discounted tickets to Broadway performances. And they too,
yes.
yes, they do have a good site. That's a good
Yeah.
suggestion. Both of
Yeah,
those
those
organizations are
two are
good.
very good
Hmm.
suggestions, yes.
Yeah. And
Thank you.
Laura, I think the guidelines are wonderful
Yes.
and really helpful. They're also available on the Cultural Access section of the Theater Alliance's website under resources. So please check those out. Um, and before I ask my question, I see Katie has her hand up. So Katie, go ahead and ask your
Hi,
question.
thank you so much for all the information. And I have a question. I don't know if this is necessarily for Laura. I don't want to like put this on you, but you mentioned having someone test your website. Is that something that you would be open to doing, or does the New Jersey Theater Alliance maybe have
I yes,
resources for that?
I would be open to doing that, and I think also the New Jersey Theatre Alliance would have resources, but I do testing a lot for other websites as well and
Cool.
give recommendations, and I do auditing as well.
Oh, great. Okay. I
Yes.
know we're recently going through a accessibility revamp, so I'd love to have
Yes.
Wonderful.
someone with
Yep.
some expertise to test that as we roll it out.
And
And that was
which,
such a good
sorry.
point, Laura, how you
Yes.
mentioned that. I think that's so important, not only for your websites, but
Yeah.
everything with regards to accessibility, your
Yes.
facility, anything
Your
that you're
staff.
doing, you want to engage the constituents you're looking to serve. And so often organizations have very good intentions, but they don't bring in the constituency in the planning phase. And
Yes.
then, Laura, as you mentioned, it's much harder to make adjustments on the tail end of
Yes.
things. So to be proactive and engage the disability community up front is definitely the way to go. And if you have any questions about that with regards to any kind of assessment where you can engage the community, please never hesitate to reach out to Kat and I. We have also an incredible Cultural Access Network committee that guides us in our work. Many of them are on today's call. So please don't hesitate to reach out, and we can certainly help you
Yeah.
identify some folks.
Yes, and to add to John's point, we should also have accessibility training for staff members. For example, like how to train your staff when they have disabled patrons coming to attend their shows and things like that, how to offer things like sighted guide audio
Mhm.
describer, the headphones, if they have anything to do with captions, how they can also include that, and other like accessibility features that maybe they could also take suggestions from other patrons, because it doesn't hurt to include all those things if you can, and hopefully many organizations can, because it is a different experience when you're able to go in independently and enjoy like all the performances and arts without facing barriers.
Right. And just a reminder that we do offer access training for individual organizations. So you can always reach out to Kat, and we're always more than happy to do training for your staff, board, and volunteers. And I see Miss Ruth has a hand up.
Yes, Miss Ruth here. Actually, Laura, that was fantastic. Your presentation was wonderful. And I'm just wondering, could we, John, if it would be okay, could we list Laura as a resource to test websites?
Yes,
Okay,
with Laura's permission.
if she
Yes,
if
that
she'd
would
be
be
Okay,
amenable.
wonderful.
And I
you
know that
have my
Shane,
permission.
oh, thank you. And I know, Laura, you know Shane Lowe. Shane was with the Olin co-design project, and I was in that. I don't know if you remember me,
Oh,
but
from All in College?
yeah, from the co-design
Oh,
project
yes,
crew.
yes.
Yeah, and so Shane Lowe he's testing my website because I don't use a screen reader, and I asked him to look at missruthhere.com, and he said it needs some changes. So Shane is a great resource, Laura's a
Mhm.
great resource, and just finding them is the hard part. Now that we have them, don't let them go.
Right,
Thank you.
right. Well, thank you. And I do thank Laura. You stepped in for us towards the end here to join us, and I'm so grateful for you to arrange your schedule sort of a little bit at the last minute to join us, and we're so
Yes.
grateful to you
And John,
for
I'm
being with us.
sorry, earlier I just jumped into the presentation without giving a full
Oh,
introduction of myself. I do work with the EDGE program. I'm a transitional coordinator. We focus on pre-EDS, the pre-EDS values. I work with high school students and college students, but I also work hand in hand with Sherlock Washington from SW Unlimited, and we work a lot with technology, accessible technology, and devices, and accessibility at large.
great. Well, thank you so much. So
Thank
we're
you.
gonna ask Diane has her hand up, and then we're gonna move over to the Garden State Film Festival. Diane?
Just 1 second. Good. I'm sorry, I'm back here now. Um, I think that one thing to keep in mind in terms of resources for testing, I know that some companies actually call in accessibility testers with various disabilities to test theirs. I will tell you that Google in particular has an extensive testing organization, and they rely on volunteer testers. And I would just suggest if you find a local website that you like, reach out to them and ask them how they test their website, because they may have either experiences or people that they're willing to share with you. And I think just like these roundtables are a way to share information, other companies that have put the effort into their website, whether they be cultural or not, may be willing to share their experiences with you.
Wonderful. Thank you, Diane. Yes. Great. So now we're, Lauren, thank you so much for being with us. So if you could introduce yourself, and we're delighted to, and thank you for walking us through a little bit of the Garden State Film Festival's website and we'll be able, Kat, we could make Lauren a co-host so she could share her screen and we could see the website and just to talk about your process too, Lauren. So thank you so much for being with us.
Oh,
Lauren
thank you
should,
for having
oh,
me.
sorry.
Yeah. No, it's okay.
I was going to say you should be able to share your screen.
Okay, great. I'll try it in 1 second. First, I'll introduce myself. I am Lauren Konkar Sheehy. I'm the executive director of the Garden State Film Festival. I'm a cis white female, now in my mid 40s, everybody. I have pale skin, red hair, and blue eyes. I'm wearing a black sweater with metallic gold polka dots, and I'm coming to you from the land of the Lenape in Colts Neck, New Jersey. So I myself do have vision and eyeball pain and problems and a whole bunch of terrible neurological things too. So I'll share my screen and let's see. This is our website. So for the Garden State Film Festival, accessibility isn't just compliance. We try to make it central to our mission, and it helps expand our audience. We don't just meet the legal requirements, we try to embrace the spirit of inclusion. So our website, it might have a lot going on, but it does adhere to the WCAG and AA standards that Laura was referencing, and it was also built with W3C compliant HTML and CSS code for current and future browsing capability. So we have accessibility right here, front and center, and it brings you right to the page. But if you go back to the home page, you can access this in several ways. So we do have it in a drop down for anybody that needs that. And sometimes on mobile, depending how people read, we also have it in the footer. So there's a lot of different ways. And over here, the quick find on the right, you can click right on the accommodations. And something really important, as soon as you get to this page, right here it states the Garden State Film Festival, accessibility first. The Garden State Film Festival screens exclusively in ADA compliant locations, and we have our phone number and our email. And so it's real human beings. I get every single email, and that is front and center. As Laura was mentioning, having your contact information if anybody has questions is super important, and we do have it as you follow along with the list of our accommodations. And it's important that we also have the time frame. Everything is requested 2 weeks in advance. We have the ASL, American Sign Language, and the website has more information. So we rent our venues. We sometimes have 8 to 10 different venues depending on just one festival. And so depending on which venue you plan on attending, we can make sure we have sign language there. Assistive listening devices is amazing, and thanks to John, we're able to have them. Even if somebody doesn't request them, now we're able to access them and have them on hand, which is really amazing. Braille. This says the GSFF Jitney Express. An accessory to everything that we do is we provide an ADA compliant bus the Saturday and the Sunday of our festival, which is, everything is all over the place. So this allows you to park once and get on the ADA compliant bus and take it around Asbury Park and the surrounding area. And they come up really close to the building, so if it's raining or inclement weather, it's really great. We have large print programs, but also what I love, because again, I do have vision problems, on our homepage, we have a flip book of our program. So you can actually download this or flip through and zoom in as large as you need to. Which, for me, that's really important. Also, we like to try to have everything streamlined and a lot of bolded font. We know there's not a lot of plow readers anymore. Plow reading is somebody that reads every single word. So even in our target marketing and our emails, our text messages, we like to have everything concise and bulleted and kind of listed in a way that your brain can kind of scan it and understand what's happening. Well, so accessibility is in our DNA for everything that we do, and that also includes our programming. So we have subtitled films, and we have listed in our program book, there's a key, a symbol key that tells you where we have the font, the whatchamacallit, the captions, as well as something called Cinema for the Ears. We created something that's an audio description for those who need it, and we have subtitles. And now, when we're in festival season mode, which technically means right now we're getting prepared for March 2026, so we have a scheduler, and you'll be able to sort by day, by time, by venue, and also by captions and audio description, so that you can see which programming we have for people who are looking for that. And yeah, our website is we're always trying to improve, so I would love any feedback, Laura, or anybody else who has any. And for wheelchairs, power-driven mobility devices, and walkers, since day one, the founder of the festival has always admitted those users for free, along with one helper. With our audience, we have seen it's very difficult for some of them to leave the house and to get out and go to an event. And so we do have a wonderful group that sometimes we're the only thing they can actually leave the house and get to once a year. And we have ushers who can assist them. But our website and our programming is pretty important for us. So I'm going to zoom in, and you can see over here the venue ID and block number. It tells you when there's subtitles and also Cinema for the Ears, which is a fun event. And one of the great things about a lot of our venues is that we can move the chairs. So we can make more room depending on how many patrons we have that need it. The Cranford Theater has 3 wheelchair or other mobility device sections. Jersey Shore Arts Center, I'm waiting for them to get back to me on their exact amount. But all the other venues, we can move everything. But yeah, our website, another fun accessory is we have filmmaker interviews, and there's audio description of the films and everything that's going on, as well as captions. And you can put the captions in any language that you might need, which is a bonus. And it's really exciting. So if you go to CC, and my computer's slow because I have 1,000 tabs open like in my brain, but it will allow you to change it to any language, which is pretty cool. We have had people use that, and our volunteers on site, they actually also use Google Translate for anyone that might need help with translation when they get to Asbury Park or Cranford, New Jersey. And if I'm going too fast, please let me know.
We do have a question in the chat that I'm going to go ahead and ask. I'm going to go a little bit out of order with the questions in the chat. If I've thumbs up your question, it means I've seen it, and we will get to it, I promise. So Piper wanted to know, has the pale yellow with the red text been tested with WebAIM contrast checker that was on the calendar page?
Oh, let me see here. We do have something that automatically checks our website, and nothing was flagged for it, but that's a great question. I can bring that up to the designer who creates this. This is last year, so for this year, we're currently in process of making it. But for me, I'm able to read that. I usually do have an issue with a lot of things. And I also wanted to quickly show you, we have a widget. So you can change anything, any page, with how you like it. If you need the contrast and have the inverted colors, they have highlight links, bigger text, text spacing, pause animations. I get a lot of visual disturbances sometimes, so I'm cognizant to not have too many moving parts, or we don't do flashing lights. I can't stand that when people don't really think about the effect it has. There's dyslexia friendly, the cursor, tooltips, line height, text align, and It's and you can even make the widget larger if needed. So it's pretty helpful. And you could see here it kind of changed all the contrast. And those of you that might not know, you can get a blue blocker. This might be different, but to protect your eyes a little bit more, there's blue blockers for the computer and also your cell phone. So my screen always looks a little orangey because I use blue blockers also. So it might be coming through a little different. But I highly recommend if you don't have a widget yet to get it. It's pretty helpful allowing somebody who can, pick exactly what they're looking for. And if you hit reset, it will reset back to the normal looking page.
Sorry, go ahead.
Oh no, go ahead.
I was just going to read a couple of comments from the chat. Katie said that cinema for the ears is a fun phrase, and thanks for sharing that. This is great. And Beth said that it's a great website. She would recommend replacing hearing impaired with hard of hearing.
Oh yeah, I saw that. Thank you. I actually forgot last year when we were talking about the new verbiage. I know I made a note somewhere, or the last meeting. I forget. Oh, okay, thank you. And the subtitles are for those who need it. That was the changed verbiage that we went through the last time. And so, yeah, if anybody has any recommendations or changes, we're really open. We're always striving to make sure that we can do whatever is humanly possible to, make sure we are accessible to everyone. And we do filter the phone calls and the emails ourselves. It's a very small team. It's myself and the director of operations. She's the one that changes the website and updates everything. And it's just us. So we would love any information that you can provide.
There are a couple more questions in the chat. I'm going to go ahead and let Miss Ruth speak, and then we will ask those additional questions.
Okay, great.
Hi, Lauren, 1,000 tabs open in my brain. You're a sketch. I'm going to use that one. As someone with Asperger's, you're speaking at a perfect cadence. Thank you. How did you learn that? That's exactly right. Feedback from a low vision user. I had more trouble seeing the red font on that calendar with the purple background because they somewhat blend together. And also, what is your widget? Is it Accessibility? What is the overlay company?
Let's look. I have a beautiful nerd that helps me with all this. Let me see. It is UserWay.
Yeah, UserWay. Okay.
Yeah.
Thank you. Okay, just never use Accessibility. That's all. I'll come on that later. Thank you very much.
Okay, great. Red font. Yeah, I'm always the one saying, we can't read that. And even the filmmakers, some of their captions, I don't know why, but they were skinny and they had a white outline instead of a black outline. So I'm the one that emails them and tells them their audio isn't, correct, or their captions. We just had a filmmaker the other day that I had to politely say, your captions are not legible. Please, fix them, because we won't screen something if it doesn't meet our standards like that. And I don't think I'm missing anything, but
Lauren, this is so helpful. Congratulations on you and the Garden State Film Festival's ongoing commitment and the work that you do. And it's always a journey, right? We're always learning, and improving. So assessing and providing feedback is so important to all of us. But you really provided some really great ideas that you've put into practice. So we're so grateful for you to share that with us. And thanking everybody too for your constructive comments and feedback to Lauren, because that's always helpful to all of us. So thank you. So we want to move on to hear from our patrons. We're so grateful to the members of our Cultural Access Network Steering Committee who provide us wonderful guidance in the work that we do throughout the year. And we have a few folks with us today to really talk about marketing and website use from their personal perspective. They are arts patrons themselves, and having them provide their own personal experiences and providing you all some tips on what works and also some things to stay away from is always super helpful to us. So I'm going to start with
Yeah.
Arlene Romoff.
John, just before we move on to that, I'm
Yeah.
so sorry. We do have a few more things in the chat, and also Piper has their hand raised.
Oh, okay.
I'm just going to go ahead with a couple of things from the chat, and then Piper, we will flip over to you if that's okay. Let me just back up a second because there is a lot happening in the chat right here.
I'm more than happy to ask in person too, because Laura and I have lots of questions from excitement, not from criticism, because I just am thrilled when I get to see and be able to help. So I put my email in the chat. I work for the Missouri Arts Council, and any arts nonprofit that contacts me can ask any access question they want. So literally, I sit in my little cubicle all day waiting for people to contact me and ask these questions. Sensory processing is my go-to in helping neurodivergents understand how their brains are interacting with their environments. So color is a big one for me, and my brain got a little spasticky with that yellow and red, which is why I asked. Happy to talk about color interactions, contrast, variance, luminous, and all of that in digital spheres. And when it comes to theater, amazing job doing cinema, doing captions, neurodivergence, because they often have an auditory processing delay, also need captions. So keeping that in mind with color and text and all that is just another access route that some people overlook. And happy to help also. Microsoft is the spearhead in helping people with understanding cognitive load theory. And that helps people understand when people use too many widgets or use overlays or use different fonts or different colors, neurologically, the way we process that information and how much energy our brain is using to determine those informations is a great way to kind of get into talking to board and other people's, even designers. Some designers are still inching into the neurodiversity, color, contrast, and sensory processing field. So more than happy to help and thrilled to hear about theater from a neurodivergent standpoint. Theater is one of the few socially accepted alternatives to social communication for understanding nuances and plays between interactions of human beings. So lots of need that theater presents. So more than happy to be here for any theater access questions. My message is in the chat. And apologies, Caucasian, late 40s female, wearing a holiday sweater today, and typically 1940s hair due to the feminist aesthetic of strength based from that time period. I'm based in a cube in a basement of a government building. So behind me, you see my attempts at doing biophilic and natural integration of a tapestry and a concrete white wall. So apologies for not giving a verbal first.
Oh my gosh,
Great.
Piper.
Thanks, Piper, so much.
Thank you. And we have Voices of the Neurodiverse as a category also. So I would love to connect. And I work at Brookdale Community College. We have an adult transition program, and I have partnerships with a bunch of other places. So
awesome. And
virtual high five.
NJPAC and Allie is my buddy. I love Allie so much.
Allie, great.
Yes, Allie is so wonderfully delicious. She came out here for a neuro arts symposium, KC. So anytime I get New Jersey in the field, I always go, NJPAC is a happy place. So you're so lucky you have a seminal neuro arts individual already integrating that concept within the state. So huzzah for Allie.
Thank you.
Great.
All right, so then another question that we had in the chat from Tanya is there anyone who knows if there are any resources for building accessibility into ArcGIS/ESRI based websites?
I can make a recommendation for somebody who might be able to help, but we had to take our old website and bring it into the future. And this was before any laws were passed that you had to implement accessibility and ADA items. So I would think about looking at the website and seeing if it's your time now to kind of fast forward and try to future proof a little bit. It might be an investment, but it will take you in the long run now and to the future.
And then Piper did provide a resource to Tanya for that, accessibility resources and accessibility standards and guidelines. Let me just scroll down. I think we already addressed, somebody asked the widget that you used was Userway.
Mhm.
And then Lauren did provide the link to that. Are there any resources for website plugins or apps for vision accessibility? I have astigmatism and websites with lots of white in the background really hurt my eyes, but I'm not sure how to fix that problem when there isn't an accessibility option on the website itself. I think there are a lot of plugins and apps out there to use. I don't have one to recommend off the top of my head. I'm not sure if Laura or someone would have one to recommend, but I'm also happy if you want to email me and I can help do some research as to kind of best practices and everything for that. I'm happy to do that. People did recommend putting on that dark mode. Sorry, I'm catching up on chat. There is a lot happening in chat right now. And then there were linked resources for dark mode UI best practices and principles for 2025. I will try to gather all of these resources so that I can make them available to everyone.
Right.
And then Kelly has her hand raised.
Yes, Kelly, and then
Okay.
we'll move on to our next presenters. Kelly?
Yes. Can you hear me okay?
Yes.
So, just try, oh, let me lower my hand. Try to connect here. We have, similar issues with the emergency management websites, at state level and all the municipalities. So I get these questions a lot. We have someone we've worked with through the Manalapan MRC CERT program who's helped us in the past to make sure things are compliant. I know on our end, we've been updating the website and it should be compliant. I thought it was going to launch in November. I'm not really sure now what's going on, but so this really I'm intrigued by because I do get these questions. I don't always know the answers, and I do know that rules change. But in addition to that, I wanted to mention to folks with the bad weather, especially that we have now, you may want to even link to our sites, and we keep our social media very current, just to let folks know, if you have delays and you need to kind of help them understand why, or need to postpone an event, feel free to link to us. I know people can get upset sometimes, but we try to let people know what the status of the weather is around the state. So thank you.
Great. Thanks, Kelly.
You're welcome.
So now, as I mentioned earlier, we want to hear from patrons and their experiences. So I'm going to start with Arlene. Good morning, Arlene.
Good morning, John. Let me see. Kat, were you going to put up those slides?
Yes, so sorry. I was
Okay.
answering some things in the chat. One moment.
Sure. It would make it easy for people to follow and support what I'm saying. Great. Okay, let me introduce myself. Let me pin myself. Okay. My name is Arlene Romoff, and my disability is that I'm deaf. I'm a late deafened adult, and I lost my hearing as an adult over a period of 30 years. And luckily, they invented cochlear implants. So I got my first cochlear implant in 1997. All the while, I have been active in advocacy for people with hearing loss. And in New Jersey, I'm a co-founder and past president of the Hearing Loss Association, of America's New Jersey State Association. And as I said, I'm deaf, cochlear implants, wrote 2 books on it. And so I'm on many, many committees that address the needs of people with hearing loss. So I put together a very 2-page outline that really covers everything you would want to know. I was very impressed with the previous presentations. The technology and vocabulary has exploded really, but hearing loss goes way back, and the access features that help us are there. They have really just come along. There are some new innovations. So let's see what we are dealing with. Essentially, for people with hearing loss, the main access services are captioning, assistive listening systems, and sign language interpreters, because the diversity of people with hearing loss actually addresses what kind of access they need. So assistive listening systems address the needs of the majority of people with hearing loss, and there are various kinds: infrared, FM, induction loops, and there's a new kid on the block called Oralcast, and that's brand new. You'll hear more about it. But essentially, assistive listening systems are required by the ADA, and they are installed in theaters and other places where people with hearing loss would congregate. There are 2 other features that are needed for people with hearing loss. For those that can't use assistive listenings alone or at all, there's captioning, and there are various kinds. There's open captioning, which is visible to all audiences, and then there's closed captioning, which is only visible to those people who request it or need it. And that comes up in theaters, movies, presentations, museum presentations. So that's something to put on your radar. For those people that are not oral but rely on sign language, there are sign language interpreters. Now, that population is relatively small. Their needs are, of course, respected, but there was always a disconnect on how many people actually needed sign language interpreters. It's relatively small, but small or not, it's definitely up there with the 3 main access necessities for people with hearing loss. So, what's very interesting about hearing loss is if you have any older relatives, there's an aging component where you start to lose your hearing. People take advantage of the fact that it's invisible and don't like to acknowledge that they have hearing loss. So that's a crazy thing to have to address if you're trying to provide access for people who are denying that they have a problem. So that really impacts your effectiveness in how you want to present your access. So the main thing is to put your accessibility provisions in the general ads, not put into some special location for people who have disabilities. No, put it in your main areas of publications that those in the general audience will see. 2 reasons. There may be people with hearing loss looking at that, or there may be relatives and friends of people with hearing loss looking at that. You're getting the advanced presentation here. In other words, you would generally just put an asterisk and put your information on page 2 of your website. No, put it in the front. It's that important. I'd like to give you the overview of the organizations in New Jersey that are addressing people with hearing loss. The 2 main ones are the Hearing Loss Association of America, which is a national, and we have a New Jersey State Association that is statewide. We do have a few chapters in the state that address local communities, and that's the initiative of people who stepped forward and founded these groups. The next is the New Jersey Association of the Deaf, which is the organization that serves people who use sign language. So those are consumer organizations. The third I've listed here is the state association. In other words, it's a government state association. It's funded by the government, New Jersey state government, the New Jersey Division of the Deaf and Hard of Hearing. And the director of that the division is outstanding, and it's really become extremely effective in New Jersey. When I say effective, think dollar signs. So the director, the executive director of that state agency has come up with grants of the past 3 years, cobbled together funds. So stay tuned to that Deaf and Hard of Hearing state agency. If you go to the website, you can get on their mailing list. The same with the other two organizations I mentioned. So it's very good to stay abreast of what they're sending out. The State Division of Deaf and Hard of Hearing does have a newsletter. So I would suggest getting on that newsletter because this is an agency that is working, a state agency that is really working. So if you've come a long way and historically, this is worth paying attention to. So let me go on to the next slide. And Kat, can you move? There's another slide.
Yes, it should be up now.
Okay, great. Great. Okay, so addressing the needs of people with hearing loss, your website, on your website, list your access services on the front page, not buried. Okay, now the reason I mention this is people with hearing loss are new to hearing loss in many cases, late deafened adults, aging, and they're not going to go digging for information, especially if they don't even know what information they're trying to dig for or that there is anything out there. So if you put your access information on your front page, that means that people who are friends or relatives of somebody with hearing loss or the person with hearing loss himself will get that information or be more likely to see that information. Because in general, people do not know anything about hearing loss and the access needs that can be provided and are provided. Okay, likewise, in your programs given out to theaters and also even in museums, your information pamphlets, put that information where people can see it because they tend not to even know that it exists. I mean, even in this day and age, 2025, there's some great access services, as you know, devices that hearing loss devices and also captioning that people just don't know about. And if you bury it under disability, nobody will see it. Put it right out there and be proud of it. Now, I mentioned also that it's helpful for reaching seniors. Seniors know nothing about hearing loss, and unfortunately, it's very prevalent in the senior population. So any way you can adapt to the knowledge that your audience that needs these access features don't even know about them, that is why you're putting them up front. So they'll be noticed. So they don't have to guess that there is something there, which they'll assume there isn't. So you get the picture. Okay, now at the facility itself, this is very interesting. We just had this discussion at one of our last meetings, and it was stated, put the signage in the lobby, like trip over it. And I was really thinking about this one. If you put your access features on a billboard in the lobby, then people will see it. And it gives it a different aura. It's something that, oh, you're supposed to know this. This is great. We're going to do this, as opposed to sticking it in a pamphlet. Oh, those are for those disabled people. I'm not one of those. Get the idea? So, at first I put this on my on this list, but thinking about it, it could really be potent in getting people used to the idea that, oh, they can use the stuff that this theater has because everybody is doing it. So that put a little asterisk there and think about that for your own facility. And the other thing that I really encourage is to start a communication with your audience. Ask them what they need. Ask them if this is helpful. Get that dialogue going, because if you think about it, that normalizes the need for this stuff. It's not like, oh, you have a disability, you are different. If you encourage that feedback, then it's a community effort. And that's 2 pages, and I think we covered a really lot of stuff that gets to the core, the people aspect of providing access services. So I want to thank you for this opportunity to give my perspectives, and I come with decades worth of experience, and I think your audiences will thank you as well.
Thank you so much,
Open
Arlene.
questions.
Thank you so much. Just a quick question. Can you repeat the newsletter that you mentioned again? There was a newsletter that was mentioned and somebody was just
in the
asking about
Division
it.
of Deaf and Hard of Hearing.
Okay, thank you
If
so
you
much.
go to the website of the Division of Deaf and Hard of Hearing.
Okay, thank you so much.
That's the New Jersey State Division of Deaf and Hard of Hearing. I didn't have the website on the slide.
Oh, that's fine. I'm going to look it up right now. I just missed it because I was responding to some chat items and someone
It's a
asked it.
state association, and on their website is fantastic, and you can sign up for their newsletter.
Thank you.
Thanks, Arlene, so much. So we've got just a few minutes, but I'm so delighted that Miss Ruth is with us. And good morning, Miss Ruth, and really looking forward to you sharing some of your experiences with websites and marketing and providing some tips based upon your own experiences. So thank you so much for being with us.
Well, thank you for having me. So my name is Miss Ruth, and I'm a vision loss community advocate based in Somerset. I'm a white, cis, golden girl of 60. I've got reddish hair with gray, let's call them highlights, and I'm wearing pink framed glasses. Let's see, I'm wearing a camel colored sweater on this chilly day. And for those energetically inclined, my aura today is purple and green. Glad to be here. I wanted to share that I usually start with the idea of every environment that's welcoming to everyone. It covers us too. So I'm a proponent of universal access. And when you create that welcome to everyone, it really does benefit everyone, especially those of us who are not used to being made to feel valuable. So this would include those of us with vision loss, in my case, and also I have Asperger's as well, but also people who are introverts with no label attached to it, no official diagnosis, as it were. Some people don't go out because the energy it takes just to be in a crowd can be wearing. So there was something, let's see, I think there was something that Laura said. Oh, I love what she said. Yes. She said it was a terrific presentation, Laura. She said the importance of being welcoming and the notion that making your website accessible engenders our trust in you. Trust is such an important word there. It's a wonderful way to frame it, because really, before we even set foot in your venue, we have formed an impression of how much you value us. We don't even know you yet, but how much trust we can put into spending our time and money with you is based on that welcome feeling or lack thereof. And, remember, we learned so much from word of mouth. I think that might be the first point of entry for most of us in the people with disabilities community. We ask each other, what was your experience? Because even if a website claims to say that they are accessible at the venue, you get there and there are thresholds and there's bumpy terrain and there's no signage. You can't find your way. So we definitely talk to each other first, I would say. And then we look at your website. And we definitely share our experiences with each other. We would love to attend live arts performances, but the experience we have begins long before we see the show. And so if it's all right, John, I'm just going to talk about, my process of finding events.
Yes, please.
Okay.
Great.
Miss Ruth,
So,
I'd like to read you a comment
Sure.
from the chat real quick. Piper just
Yeah.
said, thank you for sharing your energy colors. I've not had someone do that before, and I adore first time experiences.
Oh, wow. Thank you so much. I love Piper's energy. I already wrote your email down. I'll be in touch. I can tell she's one of my village. She's one of my tribe. And so I start with, word of mouth. I'll check with Wanda. I don't know if Wanda was able to attend today, but Wanda is the most theater going person I've ever met in my life. She gives me excellent, actionable feedback as someone with vision loss, and she has traveled recently to London to see an arts performance. And she's completely blind, so I trust her because she has boots on the ground, as it were. So I'll start with feedback from Wanda. An organization's website is next. Now, do they have accessible performances? And the next thing I look for is where do they situate that information? I know this has been touched upon. Where is that information? Do I have to pull down menus? And it's almost, in my mind, it's like wading through layers and fog. And where do I find it? It's in there. I'm searching. If I have to search and it's hard to find, that's my first impression. You can't unring that bell. It shows either a commitment or I just have to do this to be compliant with some regulations, So is it in a prominent place? I think it was Arlene who said, put it on that front page of the website. And the other thing is it's important to get feedback from the community. Let's say you make some changes to your website. You've heard that we should change something. So if you're offering an access service, and I remember this came up at a previous meeting, someone said there was an organization that offered people like me who are neurodivergent a weighted blanket. Now, that's a lovely thought, but you got to get feedback. Is that going to be used? Because from my point of view, if it's not the correct weight of blanket, if that texture is scratchy, it's a non-starter. It's not going to work. So it would really behoove you to check with your patrons. Is this something you'll utilize? If not, is there something else that might help you instead? And I would say for neurodivergent people, and I think this applies as another universal design thing, that we like to have as much space to ourselves as possible. I really hate to share an armrest. I really do. I don't want to fight with somebody the whole time. And I hate to be crammed into a chair. I'd like to have an end seat if possible. And I always harken back to Paper Mill because they're so daggone accessible. They're really stellar. And Jack Tomey over there is kind enough to provide me with a seat that is in its own kind of framed area, almost like a box. And it's hard to convey if you don't see that would be wonderful to have. It gives me a sense of security. I can't convey why. It makes me feel like all the sensory input is still sort of in abeyance. It's not coming at me, like I have my own space that I anchor down into. And if I may, Jana, I want to give a real-time example of feedback for something that happened during this meeting in terms of accessibility.
Sure.
So, John, you put something into the chat at one point thinking, I think Laura was speaking, and you were thinking, I'll put this into the chat so I don't interrupt Laura as she speaks, not say it out loud. So I'll put it in the chat. And so people with vision can read it. In the meantime, I think Laura's using a screen reader, so it's probably telling her in the earbuds what's in the chat. So it is speaking to her as she is giving her presentation. So if it were me, it would make me pause for a moment because that's sensory input. So it's, that information is only really accessible, to people who use screen readers. So you wouldn't know that without our feedback. So feedback is so important. And I think it's a lifelong learning curve, really. They say that if you know one person with Asperger's. Well, you know one person with Asperger's because we all have our different manifestations, different things that really just annoy us. I just can't stand crumbs in my space. Can't stand it. Can't work. There's a crumb here. Okay, I have to get rid of that first. Everyone has their needs and their preferences. And I think the best way is to get people with lived experience into the mix from jump. Don't wait till after. This is why I don't love overlays and widgets. I mean, I know they're important to have because we got to begin somewhere. But if you look at Accessibility, Accessibility is a widget, an overlay that ostensibly makes websites more accessible. However, feedback from the vision loss community said it actually interfered with assistive devices and technology. It doesn't work. It doesn't help us. In fact, customer service would yell at people and say, you're using it wrong. They had a really awful approach to the product and the population it was serving. So then Accessibility, the president of Accessibility came to the National Federation of the Blind's convention 2 years ago, gave a mea culpa, said, we'll change everything. Sorry about that. And they didn't change a darn thing. It still doesn't work. And now they have to pay $1 million, according to the FTC, because it was misleading claims. So talk to the community. You'll hear these things. If it doesn't work for us, don't spend your money on it. Call Laura, call Shane, let them check your website. They'll give you real-time, practical information you can use. So I'm sorry, I'm on a soapbox. So I'll come back down now. Thank you all for listening. I appreciate that everybody is here today. It really shows a lot about all of you. Thank you.
Thank you, Miss Ruth, so much. And hearing such, wonderful messaging, right, is keep coming back to us. There's lots of themes here. Important about feedback is really important. Clarity, engaging the community as you assess, making sure signage is important. I also want to just mention the importance of access symbols. We've seen them, a lot of them were on the Garden State Film Festival's website, but those, as we've mentioned multiple times, how important those symbols are for letting individuals know about your services so that they can look further. But also, if there's, as Arlene said, there could be a family member or a friend that notices it and wants to pass it on. So keep that in mind. Contact information is so important, and wonderful resources for your websites out there. Looking at sample websites that you love and reaching out to organizations for assistance, wonderful sources to test your websites. But the important thing is engaging the community, right? So before, as Laura said, try to get that feedback and engagement before you're too far down the path. It's a lot easier to do things up front than at the end. And don't hide things. Make sure that you're accessible where the information is easy to find, not 5 and 6 and 7 clicks. Keep that in mind as well. So I know we have a couple of hands up. I want to just say a quick hello to Crystal. Hi, Crystal. Crystal, are you with us?
Yes, I had to find the unmute button. Hello, Mr. McEwen. Hello, everyone. Happy holidays.
Happy holidays.
Yes, so I'm here. I was doing double duty today because I do work for the Commission for the Blind. So I had an in-person outreach event at a senior center in Clifton, but I'm stable now. And I didn't know if you wanted me to share anything or not, but I'm
Well, if
happy
you just,
if you wanted to.
yeah, quickly, because I know we're right up against 12 o'clock, but any quick tips that you'd like to share just in terms of marketing to the blind, low vision community?
Okay, yeah, sure. In considering people who are blind and low vision, definitely consider having written content, like not just graphics and written content, because We do have people who are blind and low vision who use different type of accessibility methods, such as screen readers, magnification software, and some that also can be like what is called fusion, where it's magnification and screen reader software. So sometimes if graphics might be involved, but depending on the level of their skill sets with that accessibility software, it might be a barrier where they're not able to access the content. I'm a full screen reader user. I use a screen reader software called JAWS on my laptop, and on my phone, I use VoiceOver. I am a person who identifies with vision loss, and it's important for me to be able to have that accessibility when I'm browsing different performing arts sites or applications so that I can either book my tickets or I can either find out how to register for whatever event it is, maybe it's virtual or in person, so that that equal access will be readily available. And just as the previous speakers shared, consider contacting the actual individual, because what you don't know, you just don't know. But people like ourselves who are in the community with the lived experience can offer good insight and information. And I also wanted to share that there is a resource directory in New Jersey called the Disability Resource Hub, just like how we have New Jersey 211, and that's our state resource directory. We also now have a disability resource hub where if you have accessible programming, you can list that information in that hub. A woman named Elizabeth Williams from the Division of Disability Services is the person you can contact in order to, give her your information about your accessible events or venues so that all New Jersey residents who are in our community can have that accessibility. And I'm with the Commission for the Blind. I'm the community outreach specialist statewide. So if you would like to contact me for, just sharing any of our in-service trainings, you can contact me at crystal.allen@dhs.nj.gov.
Thank you, Crystal. Before we let Diane speak, I am going to go ahead and launch a poll for everyone. If you wouldn't mind just taking a second to fill that out. Thank you.
Thanks, Kat. And Diane.
Yes, just close it. Yeah, let me close the poll.
Sorry,
Okay.
Diane.
No problem. I wanted to mention something since we started talking about websites. I wanted to bring up something that should be on your website, which does not fall under access services per se, but it's what is the access, physical access into and through your facility. For example, is there a place where someone can drop you off at the front door? Are there any steps to get into your events? I know for organizations that rent spaces, sometimes they will have alternative entrances that allow people to get in, but in terms of putting information front and center, that how do people get to your venue? Where can they park? How do you navigate through? Obviously, the information about accessible seating would be on your seating chart, or any other information you have about services. But for a lot of people in New Jersey, just getting to the theater or getting to the venue is a lot of work. And so whatever you can put on your website to let somebody know ahead of time would also be helpful.
That's great, Diane. Thank you so much. And just one thing we've mentioned before for those of you that have attended some previous sessions is I know several of our theaters, they have filmed their from their parking area their entrance, their lobby, restrooms, seating area, etc. And they've put that virtual tour up on their website. This has been helpful for individuals who might be attending the venue for the first time. There might be some apprehension about attending a venue for the first time, especially those with disabilities who are concerned about any particular barrier. So that's just another thought. We utilized and contracted a partnership with Google many years ago, but you don't need Google. You can just get your nephew or niece to do it for you. But it really, I have heard from a couple of theaters that it was one of the most popular aspects of their website was the virtual tour, which really gave the public a good idea of what to expect when they arrived at the venue. So just a tip there. So we are just a couple of minutes past noon. And I do want to thank you all so much for joining us this morning. We are so grateful for your continued commitment to cultural accessibility. I, of course, want to thank our amazing Cultural Access Network Committee for all of your guidance, our wonderful partnership with the New Jersey State Council on the Arts. Kat, thank you for always being right on top of everything with the incredible resources and support. And we are wishing everyone a wonderful holiday season and New Year. And we do have our next roundtable, which is going to be the first Thursday of January. And Kat, I believe that's where we're going to be talking about dance.
Yes, it's
right?
expanding access in dance. Mhm.
That's great. So please register. Always remember to go on to the Cultural Access section of the New Jersey Theater Alliance website for resources, upcoming roundtables, and other information. And we'll look forward to seeing you in the new year. Before we go, I just want to ask Lindsay, anything to share before we say goodbye?
I just echo the thanks. Thank you so much to John, to the Theater Alliance, to the Cultural Access Network, to the committee members who spoke today, and especially to the panelists as well. Lauren and Laura, thank you so much, and just such a rich session. And it will be on the Cultural Access Network website. I don't know if that was already said, but I'll say it again just in case. It will be archived on the Cultural Access Network webpage, so that you can access it whenever you need. Thank you, everybody, for attending today. Have wonderful holidays.
And if you have any issues finding anything on our website, please feel free to reach out. If the survey that I launched for you today was not accessible for any reason, please feel free to email me and I can provide that to you in a different format. It just asks a few questions about today's roundtable, if you've attended past roundtables, and it also has a section to include if you would like to suggest a future topic for roundtables.
Great. Well, thank you all so much. Double thanks to our panel today for your wonderful tips and guidance. And again, have a great holiday and New Year. See you soon.
Thank you so
Bye-bye.
much. Happy
Thank
holidays.
you.
Bye.